I beg to move that this House do now adjourn.
Right, I'll let the front benches have a few moments to shuffle over. Moving on to the adjournment debate. The question is this House do now adjourn, and I call Danny Chambers.
Thank you, Madam Deputy Speaker. I'm really pleased to speak today in this debate about healthcare and the future of healthcare in Hampshire. And certainly when you're both door knocking during a general election or when you're looking at the correspondence that comes in to my inbox, the NHS and healthcare services are by a long way the single biggest issue people are worried about. And I suppose after 14 years of sort of conservative mismanagement of both the economy and the NHS, I'm hearing from multiple people about how they're struggling to access NHS services, not only for themselves but for their children, which is something that causes a huge amount of stress for the entire family and friends of those who are involved. So the biggest... in 2019, the Hampshire new hospital for Hampshire was announced as one of the 40 new hospitals by Boris Johnson. And then in 2024, the Conservative MP who I was standing against once again said that there be a new hospital in Hampshire. And it was so frustrating, although possibly not surprising, to find after the general election that not only was there never any money assigned for the new hospital in Hampshire, but there's also a £22 billion deficit that we didn't know about. And now this is really difficult for hospital managers and CEOs of hospital trusts and ICBs when they're trying to plan the future of healthcare in Hampshire, to all the time have moving goalposts of not knowing whether there will be a new hospital or not. And it also caused a huge amount of stress for the residents around Winchester and especially south of Winchester, who as part of the plans that potentially involved a new hospital were told that they might lose their A&E and consultant-led maternity services. And that was one issue that we heard from thousands of people. Up to 30,000 people signed a petition to keep our A&E and consultant-led maternity services in and around Winchester. And we hear many stories of people who had their lives saved in Winchester and were really worried that they might have to travel further. The public consultation on the location of a new hospital has taken place, and it is currently being reviewed. One thing that we were very concerned about as residents of Winchester was that none of the potential locations for a new hospital that were identified as being suitable and in Winchester were included as one of the options. So people had to choose between north and south of Basingstoke. Now, this is not only a concern for people in Winchester because they're looking at travelling further for emergency health care, but also I've spoken to management at Southampton Hospital who are concerned that the further north a new hospital is built, the more people will turn up down in Southampton because it will be closer. And at the moment, they're working at capacity, and they will need a huge amount more resources if a hospital is built too far north. And we're looking at the future of healthcare in Hampshire. We should seriously consider why we would build a new hospital so close to Frimley Park, which is a RAC hospital, and only 20 minutes along the road from the A3, having two new hospitals so close to each other. So I'd really appreciate a meeting with the Minister to discuss the potential locations of new hospitals to make sure that health for everyone, healthcare access for everyone in Winchester is in the appropriate place. Because if you look at the future of healthcare in Hampshire, the location of any new hospital is key to providing healthcare for years or decades to come. But we're aware that this hospital may not be included after the review of the new hospital programme, and we need to focus on our current hospital, which is fantastic. But the NHS staff there are fantastic. but we also need to look at how we can support it now and in the decades to come.
Will the Honourable Gentleman give way?
Yes, of course.
I appreciate the Honourable Gentleman giving way, and I apologise for intervening on him without notice. He outlined the case for a new hospital on Junction 7 of the M3, which he was outlining. I do think that he is slightly muddling the argument in that clinical professionals recommended a location for that hospital with replacement services that were being taken from Winchester Hospital while maintaining a Winchester Hospital with certain services. And blue light times actually showed that there would not be a significant difference between someone in the north half of my old constituency in Eastleigh or the bit of his constituency. But the Honourable Gentleman and the new Honourable Member for Eastleigh actually opposed that new hospital. So is it not a little bit awkward for him to come and say that the government had no funding plans when he actually opposed the location and that hospital being created, and actually meant that there was a muddling of decision making because he and his colleague opposed that hospital being created in the first place?
For his intervention, and we never did oppose the new hospital. That was something the Conservatives were saying about us. We support a new hospital, we want a new hospital, we want modern healthcare services in Hampshire. But what we were very concerned about was that the location of the new hospital is not suitable when you look at how healthcare is delivered throughout all of Hampshire. But there were sites that were identified as suitable just north of Winchester. When you look at a map of Winchester, of Hampshire, it would be a much more suitable site for people throughout all of Hampshire, including the Honourable Member's constituency, to reach these emergency services. But our current A&E department, like other A&E departments, are hugely busy, especially heading into winter. And we know that many people attending are there because they can't get the primary care that they need. So we've got up to 20% of people turning up in A&E because they can't get a doctor's appointment. We've got people there in a mental health crisis, often already on a waiting list. And when a person in a mental health crisis turns up at the A&E department, they take a huge amount of time and staff resources, often taking 15 to 18 hours of needing constant monitoring until they can be put to a place of safety. And we also have people turning up with dental issues as well, because they cannot access an NHS dentist. And yes, of course.
Can I commend the Honourable for Winchester for bringing this forward, and while there are other more honourable and learned members in the Chamber that know the issue very well, but does he agree with me that the ability to bring healthcare into communities is vital? And I think that's the point the Honourable Gentleman is making, and particularly for isolated communities who can't hop on a bus every 15-20 minutes or every hour to take them to appointments, and that there are simply some areas that can't have centralised care or a new hospital but do need localised facilities. And I think if the Honourable Gentleman is asking for that, then he's asking for the right thing.
I thank the Honourable Member for Strangford for his intervention, and I completely agree with you. As a vet who's also worked in public health programmes around the world, it has been proven time and time again that it is always more cost effective to treat people in their community and keep them healthy than it is to treat them when they get sick in hospital. And that is something we need to focus on. And I know the government has said they want to move treatment from hospitals into the community. Yes, of course.
I thank the Honourable Member for giving way, and obviously I suspect he understands that I probably won't agree with him on the thrust of his argument about Basingstoke Hospital, but on the point about local community services, in my seat in Whitehill and Borden, there is a debate about whether we should keep the old Chase Community Hospital or build a new health hub. There are arguments on both sides, but the one thing that unites both sides of the argument is the lack of communication from Hampshire and the Isle of Wight ICB. Does he find it as frustrating as I do that ICB seems to not want to communicate with residents across the county?
Thank you for your intervention. And yes, I do agree. When you have a lack of communication with residents and decision makers and any other interested stakeholders, that's when you get difficulties like rumours and unnecessary anxiety. And improved communication, whether it's in healthcare or any other government department, solves a huge amount of problems. But to touch on your point about accessing healthcare when when people live in rural areas. I actually have a story about one of our residents, Margaret. She wrote to me saying she'd be given an appointment at Basingstoke. She lives just south of Winchester for a type of x-ray she's needing. Her journey to Basingstoke Hospital took well over an hour and involved multiple buses and a train, plus considerable walking time. Margaret has COPD and gets exhausted walking long distances and cannot easily afford a taxi all the way back from Basingstoke to Winchester. She pertinently asked me if people without cars were to become second-class citizens and be denied access to decent healthcare options. I guess my point here is that that healthcare access, you have to look at individuals' situation, and that can include needing really good public transport, and the more community care we have in people's towns and homes and villages means they can get there much more quickly from their home. The other side of emergency care and in A&E departments is obviously social care. And we've said many times you cannot fix the NHS without fixing social care. And we know that when we've got people in the Hampshire Hospital Foundation Trust, there's between 160 and 200 people at any given point who are well enough to be discharged and would be more appropriately cared for in the community with social care packages. And currently, they're stuck in a hospital bed and they cannot be discharged. And this means that that patients can't be moved out of A&E as quickly as they could be. It means that people cannot be removed from ambulances as quickly as they could be. It means that ambulance waiting times are longer. And when I speak to the CEO of Winchester Hospital, he said that the single biggest help that they could get from government is another 160 social care packages. And although people ask, where will the money come from, we know it is actually more expensive to keep someone in a hospital bed than it is to give them a social care package. And we've got winter pressures coming up very soon. Winter has already started. And the CEO of Winchester Hospital has told me on more than one occasion that to help with winter pressures, more social care packages is probably the single biggest intervention that would make a huge difference. And currently, local authorities struggle to afford social care packages, and the NHS trusts are having to fund some of those social care packages out of their NHS budget, which is primarily meant for treating people in the hospital. One of the biggest concerns raised by Winchester residents is the potential removal of consultant-led maternity services at Winchester Hospital. And it means if a woman were to hemorrhage or require an emergency C-section during labour, she would need to be transferred in an emergency situation. And to put this in perspective, in April 2024, 22.7% of births were performed by emergency C-sections in Winchester Hospital. It's clear that surgical interventions are not an unusual eventuality, but something that will affect more than 1 in 5 mothers. An emergency transfer in such situations, they'll inevitably put the lives of some women and babies at serious risk, and tragically some could be lost. A constituent wrote to me about her daughter, who recently hemorrhaged badly after giving birth to a baby who was a breech birth. The blood transfusion and life-saving surgery to remove her placenta needed to happen within minutes. And it's unthinkable what would have happened had there been no consultants on hand. And as someone myself who only on animals rather than humans has performed many emergency caesareans, I know that time is of the essence, and anything that delays the time from an emergency occurring to getting surgical intervention can make a huge difference, not just on whether the person and the baby survive, but whether the baby has potential brain damage and other life-changing complications. As a Liberal Democrat mental health spokesperson, I also see this debate as a chance to highlight how desperately we need more resources put into mental health alongside a more holistic approach to treatment. So when speaking of residents of Winchester, one of the most common concerns they share is the difficulty of accessing mental health care. And this is especially true for parents. Parents who are struggling to access healthcare for their mental health care for their children. I spoke to a constituent near Swanmore who was struggling to access the mental health care and support they needed for their child who was anorexic and had eating disorder. And they had been informed that the child had to reach a lower BMI until they qualified for the threshold to get treatment because resources are so stretched. And there's no other disease where that would be considered even remotely acceptable. You would never say to someone, your cancer needs to reach stage 4 until you qualify to the point where you qualify for treatment. And we know that outcomes when you have delayed treatment for mental health and physical health disorders, which eating disorders are a combination of both, are going to be much less successful, and they're going to be much less cost effective, requiring longer treatment and less successful treatment the longer it is left. And so I'd urge the Minister to take a particular concern over young people's and children's mental health, because delays in mental health treatment for anyone can be catastrophic. But when you're only 13, 14, 15 and facing up to 3-year delays, it's a huge, huge chunk of your life. And as part of this, we urgently need to invest this in primary care. Failing to address this will only place greater pressure on already overstretched hospitals. And I've certainly spoken with people who've spent extended amounts of time in hospital bed because they cannot get the mental health care that they need. And similarly, the lack of NHS dentists often forces patients to turn up to hospital, sometimes needing a general anaesthetic to sort out tooth-root abscesses, and this costs more than providing the NHS dental care. And it seems as though all the dentists I speak to say that the current contract that they have for performing NHS care isn't fit for purpose. And so I'd urge the Minister to look at this as a matter of priority, because there's so many people not receiving the dental care that they need, and it seems as though it's something that will not be resolved until the NHS contract is looked at. The other issue of people getting healthcare in their communities, especially around Hampshire and Winchester and Meon Valley, is that pharmacies are really struggling. And it seems to be a very similar situation with dentists, in that the arrangement they have with the government for providing prescription services doesn't seem to be fit for purpose, and it seems to be costing them money to provide prescription drugs, and they're telling me that their pharmacies are not viable. And the more we end up losing pharmacies, the further people have to travel to not only collect drugs but get medical advice and vaccines. I guess to conclude, I just want to really pay tribute to the NHS staff. I imagine they dread winter coming up. Every year it's a stress for them. Every year they're overworked, and every year we know that they all work longer hours than they're contracted to, and this is for both clinical and non-clinical staff. And I know that they'll be bracing themselves right now. They're going to be busier, and they also put themselves at risk for getting things like flu, COVID, other types of respiratory diseases that we see in winter as well. And one thing we can all do, is both as the public and as the government, is encouraging everyone to get vaccinated ahead of this winter flu, just the winter pressures, because anything we do to prevent a trip to hospital will make their job easier and make it less likely that they get sick. Yes, I'll give way.
I thank the honourable gentleman for giving way. He speaks eloquently on a wide range of healthcare challenges within Hampshire. Would he agree with me that our shared integrated care board for Hampshire and the Isle of Wight must do all they can to make the best of the situation they've got, particularly in relation to NHS dentistry, but also funding for hospices across Hampshire and the Isle of Wight?
The Honourable Member makes a very good point about hospices in particular. We know hospice funding is only about a third provided by the government, and it's a hugely, not only emotive subject, but it affects not only the people who are in a hospice, but the whole family who are also trying to care for a loved one who's often only got weeks or months left to go. And some of them, we've got 2 hospices in Winchester, and one of them is a children's hospice near me house, and some of the most moving visits I've ever done have been to visit hospices, and the staff and the patients there are just incredibly brave in what they do. And we have an assisted dying debate coming up, and we really have to look at palliative care, hospice care, how it's funded, how we make it sustainable, and how we make it really fit for purpose. So thank you for that really important intervention. I just want to finish as well by saying that many constituents write to me to tell me about the excellent care they receive in hospitals and how much they appreciate the hard work of the NHS staff. A Winchester resident, Owen, wrote to me saying that the hospital, he honestly doesn't believe he'd be alive today if it weren't for the Winchester Hospital. Owen sadly suffers from a brain tumour in the pituitary gland and has needed emergency treatment on multiple occasions. Owen lives 5 minutes from the hospital and has managed to have life-saving treatment there on multiple occasions. And he says if Winchester Hospital wasn't there, he wouldn't be alive today. So we need to avoid the trap of cutting short-term costs, such as not investing in social care, which has ended up costing the state so much more money in the long run. We need a comprehensive plan to give people adequate local health care throughout their lives and escape from this endless cycle of crisis after crisis. And I suppose the final point is just to ask the government is that we know winter is coming this year, we know it is coming next year. What are we doing to make sure we don't have an NHS crisis in Hampshire next winter as well? Thank you.
Andrew Gwynne.
Thank you, Madam Deputy Speaker, and can I congratulate the Honourable Member for Winchester for securing this debate. And I want to also echo his thanks for the work of all the health and social care staff out there who are doing incredible work in very difficult circumstances, because, Madam Deputy Speaker, what we do know is that our NHS is broken. And whenever MPs from across this House come to me with issues affecting their constituencies, I repeat the same mantra, that this government will be honest about the issues facing our NHS and we will be serious about tackling them. Lord Darcy has already completed his review of the current state of the NHS, and his report laid bare the true scale of the challenges facing our health service. And so we will not sugarcoat the problems faced by the health service in each and every part of the country, because colleagues from across the House are right to raise issues with me, and we will fix them together. We've already launched our national conversation on the future of the NHS, and we want patients, families and staff to join this conversation and to make their voices heard. And if you've not already gone on there, it's change.nhs.uk, and please let's have some sensible suggestions and not necessarily firing the Secretary of State out of a cannon. But Madam Deputy Speaker, that's not all. In her spring budget, the Chancellor of the Exchequer announced an extra £22.6 billion to protect NHS day-to-day spending. Every penny of this investment will come alongside vital health reforms, two sides of the same coin. And as the Secretary of State outlined last week, it is this government's intention to publish a league table of providers, allocating the best talent to the most challenging areas and ensuring that there are no rewards for failure. Where it's necessary, we will remove failing managers, and where senior leaders successfully improve performance, this will be rewarded.
Will the Minister give way on that point, please?
I will.
Thank you. I really appreciate the Minister giving way. In terms of failing organisations, just before the general election, a cross-party, including Labour MPs, had a meeting with the Secretary of State, the then Secretary of State, about the performance and the management of Hampshire and Isle of Wight ICB. There are serious concerns from members of Parliament across the political divide on the leadership, communications and funding of that ICB, not in terms of government funding, and I welcome his increased funding, but in terms of the way that is distributed to services within Hampshire. Quite frankly, Madam Deputy Speaker, I do not think the leadership is up to running that ICB. So will he agree to meet with me and other members from across this House to discuss the urgency, and will he find out from his civil servants where the request for a 2-week action plan went and come back to Hampshire MPs on that, please?
I mean, I'm certainly happy, and I'm sure officials in the box will have noted the concerns that he's rightly raised about his ICB, and I will make sure that that's communicated back to the Minister for Secondary Care, and that she can look in more detail at the concerns he has raised, communicate with the Hampshire MPs, and if a meeting is necessary at the end of that, I'm sure she will be more than willing to meet with the Honourable Gentleman and his colleagues, because we want to ensure that every part of our NHS is working as well as it can be, and as I say, good performance will be rewarded as part of our reforms. This, alongside a new college of executive and clinical leadership, will ensure that the NHS continues to develop and attract the best talent to the top positions, bringing the best outcomes for patients and for taxpayers alike. Now let me turn to some of the specific issues the Honourable Gentleman has raised. Firstly, on local hospital provision. Madam Deputy Speaker, patients deserve to have safe, compassionate and personalised care in an environment which is fit for purpose. That's why this government is committing to building and refurbishing hospitals across the country. The new hospital programme includes a new hospital for North and Mid Hampshire and a major refurbishment at Winchester to provide specialist and emergency care. As part of the proposal, I'm aware that the local trust explored changes to the current obstetrician-led maternity services at the Winchester site. Now, I know the Honourable Member has been a strong champion for this, raising it with the Prime Minister, I believe, in October this year. Now, as announced in the Chancellor's autumn budget, my right honourable friend, the Secretary of State, will set out further details of the review of the new hospital programme in coming months, alongside a new and realistic schedule for delivery of the programme. The Hampshire Hospital Scheme is in scope of this review, and I acknowledge the local concern over the proposal and the impact on the Winchester site and on maternity services. I will. Yeah.
for giving way. So my constituents, as it happens, use both Winchester Hospital and Basingstoke Hospital, and others, by the way, like Frimley and QA and Guildford. But I understand the clinical assessment that was made and the urgent treatment and services at Winchester, but the need for the new hospital in or near Basingstoke. In what he says about the review of the new hospital programme, and I accept that he says there's a statement coming soon, but can he just confirm that what he means by that review is about timing, and that he or a colleague is going to come forward soon to this House with the certainty that people in Hampshire need?
Yeah.
Absolutely. I mean, look, I'll try and be as unpartisan as I can be, but the hospital programme we inherited from his government did not have anything like the money backing it up, and they can shake their heads, but this is true, nothing like the money backing it up in order to bring forward those hospitals. And as I've said already, we will review that. It is our intention to bring forward these schemes, but it has to be done in a way and in a programme that is achievable with the finances to back it up. And when we announce to the House how we are scheduling the hospital programme, I expect that all the answers the Right Honourable Gentleman wants will be there. It is our intention to bring forward the hospital building programme, but it has to be done with the money. We can't build it with fresh air. Madam Deputy Speaker, I will give way.
Thank you, Madam Deputy Speaker. Would you agree with me that any potential new hospital is going to be at least decades away, and we currently have a hospital that needs to be maintained and needs to be improved, and the quickest way we can do that is to provide 160 new social care packages for Winchester Hospital? Would you meet with me and the CEO of Winchester Hospital so we can work out how we can deliver these as quickly as possible and provide a really good both A&E and hospital and social care service for everyone in and around Winchester?
Well, look, it's very crucial that we have the best possible health and care services in place now for today's needs while we are planning for the future, and I understand the concerns he's raised, and I will make sure that that's communicated back to the Minister for Secondary Care so that she, as part of her deliberations, can consider what he said and will ask her to report back to the Honourable Gentleman on that, because ultimately all decisions are best made when they are made locally to cater to the local interests and that are clinically led, and this is no exception. I know that his trust will be considering all feedback from a public consultation which ran earlier this year. This consultation includes feedback from those who will access the new facilities along with wider bodies of evidence. The outcome of the public consultation on the location and the services of the scheme will be put forward to the local Integrated Care Board, and we look forward to hearing the outcome of this process. I will give way.
Thank you, Madam Deputy Speaker. Apologies for intervening so soon again. One of our main concerns in the public consultation was that the NHS had assessed sites in Winchester as being suitable, and then they were not included in the public consultation. And people in Winchester want to know why suitable sites in Winchester were not included in the public consultation. Could you assure me that this will be specifically be addressed by the ICB and anyone else who's assessing this, publishing this consultation?
Well, I have to say to the Honourable Gentleman that, as I mentioned before his intervention, ultimately these are local decisions and they have to be clinically led. So if the Trust has come to a decision that certain things that he would like to see are out of scope of the consultation, we have to take it as read that there are sound clinical reasons for that, but if he thinks that's not the case, I'm sure he will be able to bring that up with my honourable friend, the Minister for Secondary Care. But ultimately, we have to be guided by the clinicians and by what they know are the better outcomes for their local areas than certainly we as ministers in Whitehall will ever know. The Honourable Gentleman mentioned primary and community care, and we know that patients nationally and in Hampshire are finding it increasingly difficult to see a GP, and we are committed as a government to fixing the front door to the NHS to ensure that patients receive the care that they deserve. If patients can't get a GP appointment, they end up at accident and emergency, which is worse for them and more expensive for the taxpayer, and that's why we will shift the focus of the NHS out of hospitals and into community. One of our three big shifts is from hospital to community, the other from analogue to digital, and from sickness to prevention. And these three things, taken as a whole, could be quite transformative in how we deliver primary care going forwards. I will give way.
Thank you, and I am grateful for the Minister for giving way, and I agree with him entirely of that shift from hospital to community. But I don't want to labour the point I made when I intervened on the honourable gentleman who is leading this debate. But in Hampshire, in my part of the Hampshire part of my seat, we have this debate about whether we're going to have the Chase Community Hospital still there or a new health hub, both essentially local services. The ICB is dragging its feet. It won't make a decision on which side it's going to be, and that means that local people don't know what's going to happen in the future, and decisions that are being made are being kicked down the road by the ICB. And as my honourable colleague said here, the leadership of Hampshire and the Isle of Wight ICB is not fit for purpose, and will he meet with us and them to ensure that we can get this moving?
Yeah.
I hear very loudly and clearly what honourable members opposite are saying about the leadership of their ICB. I hope that the ICB management will obtain a copy of today's Hansard and not only read those comments but read the Minister's reply, in that I expect that they make decisions in a timely fashion, so that there is some certainty within the local population of the new makeup of health and care services in that area, but also, not just for the sake of patients and certainty for the local populations, for the staff as well. It's absolutely crucial that as you're redesigning services, and maybe some parts become obsolete as we change towards more preventative, community-focused care, that we take the workforce as well as the population on that journey of change in services. So I hope very much that his ICB leadership will have heard that message from the dispatch box, from the Minister, that they really need to crack on, make a decision and communicate that, and work with both members of Parliament, the public and the staff on whichever changes they propose. Returning to primary and community care, Madam Deputy Speaker, our manifesto commits, as I say, to moving towards a neighbourhood health service with more care delivered in local communities to spot those problems earlier. We will bring back the family doctor by incentivising GPs to see the same patient so that ongoing or complex conditions are dealt with effectively. In doing so, we will improve continuity of care, which is associated with better health outcomes for patients. And our plan will guarantee a face-to-face appointment for all those who want one, to deliver a modern booking system which will end the 8 a.m. scramble, which is crucial to improving access to general practice. On dentistry, the honourable gentleman rightly raised the huge problems in his area, which are not that uncommon across the whole of the country. I don't believe that the previous government's dentistry recovery plan went far enough. There were too many people still struggling to find an NHS appointment. We are working to ensure that patients can start to access additional urgent dental appointments as soon as possible, and we will be targeting the areas that need them most, the so-called dental deserts. Integrated care boards have started to advertise posts through the Golden Hello scheme. This recruitment incentive will see up to 240 dentists receiving payments of £20,000 to work in those areas that need them most for 3 years. The common reason that children aged 5 to 9 are admitted to hospital, and this is absolutely shocking in the year 2024, is for tooth decay. We will work with local authorities to introduce supervised toothbrushing for 3 to 5-year-olds in the most deprived communities. These programmes are proven to reduce tooth decay and to boost good practice at home. To rebuild dentistry in the long term, we will reform the dental contract with the sector, with a shift to focus on prevention and the retention of NHS dentists. To be fair, it's something that all governments, going back to the Labour government that introduced the dental contracts for the right reasons, but in 2010 we recognised that the dental contract wasn't working in the way we envisaged and had to change. It's just shocking that 14 years have passed since then and no real action has been taken, and we are determined to fix that. At the same time, we will not wait to make improvements to the current system where these can increase access and incentivise the workforce to deliver more NHS care, and we are continuing to meet the British Dental Association and other representatives of the dental sector to discuss how we can best deliver our shared ambition to improve access for NHS dental patients. And I have to say, the local statistics for Hampshire and the Isle of Wight Integrated Care Board make sorry reading. Only 36% of adults were seen by an NHS dentist in the previous 24 months to June 2024, compared to 40.3% across England, and 54% of children were seen by an NHS dentist in the previous 12 months to June 2024, compared to 56% in England. In 2023-24, there were 46 dentists per 100,000 population in his trust, whereas the national average across all ICBs was just under 50 in the same year. And in 2024, the General Practice Patient Survey success rate for getting an NHS dental appointment in the last 2 years for Hampshire and the Isle of Wight ICB is 72% compared to 76% nationally. They're not great statistics nationwide, but they're certainly not brilliant in Honourable Members' ICB, and we look for real improvements there. In terms of pharmacy, of course, we want to take pressure off GPs by increasing the services offered in community pharmacies. There's so much more that our pharmacists could and should be doing to deliver basic healthcare services on the high street, in the community, part of that shift from hospital to community, freeing up thousands of GP appointments where people basically don't really need to see a general practitioner for the kind of conditions they have. We are committed to look at how we can further expand the role of pharmacies and better utilise the clinical skills of pharmacists as more become independent prescribers, and that's where the potential gets really exciting. Now that the budget for government has been set, we will resume our consultation with Community Pharmacy England shortly. I'm unable to say more until these have been concluded, and I hope members will understand, but suffice it to say, Pharmacy First and community pharmacies have a huge role in improving health outcomes in the community, and I will give way.
In my former role as an Assembly member, we had a very, very close relationship with the pharmacists back home. What the Minister is outlining in the consultation process for England is something that we would very much welcome in Northern Ireland. So I ask the Minister a favour, please. Whenever that consultation takes place and concludes, would the Minister share his findings with the Northern Ireland Assembly and with the Minister in particular? Because I just think what the Minister is hoping to achieve is something that we would like to achieve as well. Thank you.
I'm very grateful to the Honourable Gentleman. He raises a really important point because, look, there's no part of the United Kingdom that holds a monopoly on wisdom. And if we're doing something good in one part of the United Kingdom, if there's innovation in one part of the United Kingdom, I actually think it's incumbent on health ministers across the devolved administrations and here in Whitehall to share that best practice, to work together and, where possible, on a four-nation approach. And I hope I can reassure the Honourable Gentleman that since this new Labour government came into power, we have really tried to reset our relationships across the devolved administrations, the various ministers, and I've had several meetings with Mike Nesbitt on a range of health issues that appertain to the whole United Kingdom, where, Madam Deputy Speaker, we want to ensure that there is consistency of approach. And I'm more than happy to communicate further with Mike Nesbitt and colleagues in the Northern Ireland Executive on how we reform our health and social care services here in England, to see whether there's things that can be taken by them in Northern Ireland, and vice versa. If there are good ideas, Madam Deputy Speaker, from Northern Ireland, I'm more than happy to consider them in how we transform NHS services here in England. Madam Deputy Speaker, social care was mentioned by the Honourable Gentleman, and he's right to raise winter resilience. I've spoken about fixing the front door to the NHS through primary care reforms. We've also got a serious job to do to fix the back door and ensure that the patient flows through the system aren't held up because of lack of social care. In terms of winter resilience, I hope he will understand that we are working to ensure that there are no crises and that we tackle these issues. Social care and getting beds in appropriate places is a key part of our plan going forwards. But look, in the long term, there are no quick fixes here. The Dilnot reforms that were announced by the previous government, it's fair to say that when we came into office, we found that the money that had apparently been set aside for Dilnot reforms had already been spent on other NHS pressures. And laudable whilst it may have been to spend that to try and get waiting times and waiting lists down and to try and fix some of the problems that their government themselves had created, it left us with a bit of an issue when it came to social care, given that that reform money had gone, disappeared, no longer there to be spent. Over the next decade, this government is committed to building consensus on the long-term reform needed to create a national care service based on consistent national standards, including engaging cross-party. And I know it's good to see the Shadow Secretary of State in his place, and I'm sure he will be very willing to work with us, as indeed will the Liberal Democrats, and we genuinely want to make sure that we do get cross-party consensus when it comes to the future of our adult social care, so we can finally grasp this nettle for once and for all and to fix it without it becoming such a contentious issue, as sadly it became in 2010 and as sadly it became in 2017. And none of the two main parties have a good story to tell on this, because we have both shamefully used it as a political football from time to time. It's now appropriate that we set aside those politics and we get on with fixing social care. And I hope that in due course we'll be able to move forward on that agenda. Madam Deputy Speaker, when it comes to mental health, I want to assure the Honourable Gentleman that we are acutely aware of the problems that there are when it comes to mental health services, and we both agree that waiting lists are unacceptably high, and indeed the people of Hampshire and most of England are not getting the mental health care they deserve. He's spoken previously about Lord Darcy's report, which has shone a searing spotlight on the waiting lists that young people in particular face. I'm immensely proud that this government is intent on tackling this issue head-on, with specialist mental health professionals in every school in England. That's our aim. These NHS-funded mental health support teams in schools and colleges will work with young people and parents to manage mental health difficulties and to develop a whole school approach to positive mental health and well-being. I'll give way.
Just check I heard him correct. Did you say a mental health specialist in every school in England?
Yes, that's our manifesto commitment. There will be mental health specialists for every school in England. In Hampshire, there are mental health support teams assigned across the area, including schools in Winchester, in Eastleigh, Andover and Havant. In addition, we will introduce Young Futures hubs in every community and recruit an additional 8,500 mental health workers across children and adult services. We've also set aside £26 million in capital investment for new mental health crisis centres, and we are expanding NHS talking therapies alongside individual placement and support schemes. To conclude, Madam Deputy Speaker, this government is committed to fixing the NHS so that patients, including those in Hampshire, can access excellent care when they need it. It's true to say that every Labour government has inherited an NHS in far poorer state than that which they bequeath to their successors. And it turns to this Labour government to fix our NHS once more.
The question is that this House do now adjourn. As many as are of that opinion say aye. The ayes have it. Order, order.